How are you?
Oh, I think I'm quite great.
Oh, okay. So, let us start our class now. I think you will like our topic now.
Yes,
Our topic is all about bone marrow aspiration.
yes. Vulnerable value.
Yes, okay. This one. So, to start our class,
Yes,
okay, let us watch this first. Okay, this one.
duration.
Doc, can you hear it?
Yes.
Ah,
Oh
good.
no. I can't hear.
There's no sound, right?
I can't hear. I can see, but I can't hear.
Yeah, there is no sound yet. This one. There is no sound, right? Let me check this one. There is no sound here. There also?
No sound, no
Không
sound.
có âm thanh ở đây.
Oh, okay, okay. Let me check this one.
Yeah.
Mm. Wait, what is bone marrow? Oh, this one maybe. Let's try this.
How can optimizing our
Okay.
operations through AI and
Yes,
machine learning
Yes,
technology
you
help
can hear
us
it, Doc?
continue to meet?
yes, I can
This
hear.
video will
Okay, very good, very good. Okay, this one.
demonstrate the procedure for bone marrow
Wow.
aspiration and bone marrow biopsy from
Ooh.
the posterior iliac crest. Obtaining a bone marrow aspirate and core biopsy is often necessary when evaluating a patient who has a hematologic abnormality.
Oh.
Examining bone marrow is also useful in the diagnosis of metastatic spread of non-hematologic malignancies and to diagnose metabolic disorders.
Metabolic disorders.
Gather the necessary equipment prior to performing the procedure. You will require equipment for sterile skin preparation and a sterile field, 1% lidocaine buffered with sterile sodium bicarbonate, a 25-gauge needle and 5-milliliter syringe, a bone marrow aspiration needle, a bone marrow biopsy needle, two 30-milliliter syringes, sterile heparin sulfate, sterile gauze, and bandage. Several types of bone marrow biopsy needles are commercially available. This video will demonstrate the use of the Jamshidi needle for obtaining a core biopsy. There should be an additional team member present responsible for immediate preparation of specimens. As you prepare to perform this procedure, ensure that there are no contraindications, that consent has been obtained after explaining the procedure, and that you have gathered the necessary equipment. Bone marrow aspiration and biopsy should not be performed if an infection of the bone is suspected. The posterior iliac crest is the most common site used to obtain bone marrow. This site can be reached with the patient in either the prone or decubitus position. This video will demonstrate the decubitus position. The patient should be positioned in the right or left lateral decubitus position with knees flexed. The posterior iliac crest is located at the center of the posterior superior iliac spine. With the patient lying on his or her side, palpate the posterior iliac crest. If there is a reason not to use the posterior iliac crest, bone marrow aspiration from the anterior iliac crest may be performed. Though the sternum can be used to obtain a bone marrow aspiration under exceptional circumstances, it is not suitable for a bone marrow biopsy. Once the patient is positioned, the site should be prepped with a chlorhexidine scrub and draped with sterile towels. As with all invasive procedures, meticulous care should be taken to minimize the risk of infection. While the invasiveness of the procedure may not necessitate a sterile gown and mask, the operator should don sterile gloves and adhere to strict standard precautions. At a minimum, the patient will need medication for procedural pain. The needs of each patient should be considered and discussed in advance. Local or systemic analgesia, or both, may be indicated. Some patients may need medications to induce conscious sedation. Deep sedation is generally recommended for all pediatric patients. A separate clinician should be responsible for monitoring the patient's sedation and physiological status during the bone marrow procedure. After sterile preparation, 1% lidocaine should be slowly injected to raise a wheal over the biopsy site. Then, infiltrate the periosteum with 2 to 5 milliliters of buffered lidocaine. In the awake patient, ensure the adequacy of local anesthesia by gently tapping the periosteum with the tip of the needle used to deliver the anesthetic. Be sure that you have prepared the appropriate number of 30 milliliter syringes with and without heparin prior to starting the bone marrow aspiration. Inspect the bone marrow aspiration needle and remove the plastic guard if one is present. Hold the needle horizontally and insert it into the skin over the posterior iliac crest. Advance the needle until it contacts.
Doc, is this painful?
Yes.
Oh, okay.
Bone. To engage the bone, the needle should be rotated alternately, clockwise and counterclockwise, while applying steady pressure. When the marrow cavity is entered, a sudden decrease in resistance is usually felt. The ilium is a large bone, and the marrow space should be located easily. However, the angle of entry is important. In general, the needle should be advanced at an angle completely perpendicular to the bony prominence of the iliac crest. Once the needle is through cortex and the marrow cavity is entered, the needle should stay in place without being held. Next, remove the stylet. Attach a 30 milliliter syringe without heparin and aspirate 1 milliliter of marrow with a firm pull. Since the aspiration itself can be particularly painful, it is prudent to warn the conscious patient before you aspirate.
Wow.
Note that you may hand a syringe to an assistant or pathologist, taking care to maintain sterility. The non-heparinized aspirate should be used to prepare specimen slides. Adequacy of the specimen can be verified by the presence of bony spicules in the sample. Next, aspirate marrow into syringes containing 1 milliliter heparin as needed for diagnostic tests. Remove the aspiration needle and apply pressure with sterile gauze until you are ready to perform the biopsy.
Wow.
I would die in my hospital.
Yeah.
Bone marrow root aspiration and biopsy of bone marrow.
Yes, it's my first time to see this, Doc. My first time to see this. This one. Okay, here.
Bone marrow biopsy is often done following a bone marrow aspiration. Maintaining sterility, obtain a bone marrow biopsy needle.
No.
Holding the needle between your palm and index finger, insert the needle into the patient's skin and advance until it touches bone. If an aspirate has been performed, the same entry site through the skin may be used for the biopsy. However, a skin incision may be indicated if only a bone marrow biopsy is being done, or after an aspirate to allow for entry of the larger biopsy needle. While applying steady pressure, advance the needle with its stylet in place into the cortex by rotating back and forth. The biopsy needle should be inserted into bone at a slightly different angle than a previously performed aspiration.
Whoa.
Once the needle is anchored in bone, remove the stylet. Continue to advance the needle 1 to 2 centimeters into the marrow cavity with a back and forth rotating motion. The stylet may be reinserted to determine the length of the biopsy specimen in the needle. In order to remove the biopsy specimen, It must be detached from the surrounding marrow and bone. Do not pull the needle straight out, as doing so may allow the specimen to remain attached to surrounding marrow and prevent it from being removed in the needle. Rotate the needle 360 degrees several times in both clockwise and counterclockwise directions prior to removal. The needle should then be rocked back and forth to ensure detachment of the specimen from surrounding marrow. Slowly pull the needle out while continuing to rotate. Remove the specimen from the needle by inserting a sterile probe into the distal end of the needle and push the specimen through the hub onto sterile gauze or a slide. Inspect the specimen for adequacy of marrow. Apply pressure to the biopsy site with gauze until any bleeding stops, and cover with a bandage or pressure dressing. Instruct the patient that the dressing can be removed the next day, and that they should protect the wound from contact with water until a firm scab is formed. Any substantial bleeding from the site should be reported to the physician. The patient may experience soreness at the biopsy site for 1 to 2 days that is best controlled with oral analgesics. The patient should be instructed that anything out of the ordinary should prompt physician evaluation.
Okay, wow, that's a pretty interesting video. Okay. Okay, that's one. Um, that is very new to me. That one. Okay. So let us have a question and answer about it, Doc. Okay. First question is, what is bone marrow aspiration and why is it performed? Okay, that's one.
Uh, bone marrow aspiration and biopsy is a very important procedure in hematology because this this help do some tests to diagnosis hematological diseases such as bone marrow failure, leukocyte, multi-myeloma, bone marrow cancer, marrow.
Mm.
The person always needs the test bone marrow cytology or and histopathology in
Mm.
bone marrow.
Oh, wow.
Yes,
Wow.
bone
Okay.
marrow is a company where products own stem cells, blood stem cells, and blood cells. Yes,
Mm.
the leads white red blood cell and white blood cell is very important, and in this is important and necessary procedure to do prognosis this hematological disease.
Okay. Doc, I want to go back with this word. We read this as, let's read this again. We read this as biopsy. Yeah.
My nephew.
Yes, this one. Mm. We read this as biopsy.
Biopsy.
Yes.
Biopsy. Yes.
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 Okay. Now let us go to the next question first. Okay, let me bring you there. Okay. Number two, which bones are commonly used for bone marrow aspiration? Okay, this one, Doc.
Oh, the bone marrow in the pelvic.
Pelvic.
Sometimes, sometimes we often biopsy in intern, external from
Mm. Okay.
we often biopsy and aspirate the fruit from bone marrow bone pelvic.
Oh, okay, that's interesting. For a while, Doc.
I can't hear. I can't hear.
Doc, can you hear me?
Yes,
Ah,
yes,
okay,
yes.
okay, okay, good, good. Okay, next. Okay, this one. What are, okay, this one. I will ask in the intermediate part. What are the contraindications for performing a bone marrow aspiration?
Mm, oh, we I think there is no contradiction. Um, there is a few a few contradictions such as the breathing when the person with very low breath rate is blood.
Oh, mm-hmm. Okay.
This and we often stop breathing with what what
Mm-hmm. Okay, okay. Now let us, okay, I will put that here, Doc. Okay. Now let us go to the next question, Doc. Okay. How does bone marrow aspiration differ differ or from a bone marrow biopsy? Differ.
yes
Yes.
yeah bone marrow aspiration to do aspirate 2 milliliters of milk blood and this do and this blood do do test of pathology.
Mm. Mm.
But
Okay.
myoxide is touch touch a bone piece of bone.
Mm.
It's very important to assess the bone marrow and
Mm.
to diagnosis bone marrow failure and many disease.
Oh, okay. So in biopsy, they took a piece of bone, a
Piece of
piece
bone.
of bone. Yes,
One.
this one.
And then yes, and the piece of bone to test called histopathology.
To test the histopathology. This one.
Yes.
Okay. Mm-hmm. Okay, thank you, Doc.
Um,
Now, this is interesting. What are the major components of bone marrow? This one.
oh, major components of bone marrow is stem cells, blood,
Ah,
and bone and bone.
and the bone. Oh,
And
okay.
what is it? Fat root of fat,
Mm,
fat,
fat.
fat. Yes, fat.
Oh, fat. Oh, okay.
Fat root.
Doc, bone. Oh, let me check. Bone marrow has fats. Just
Yes,
one. Oh,
root,
okay, okay.
yes,
Okay.
root.
Now, Doc, I just want, before we continue with the questions, this one, bone marrow failure. Okay. Okay, here. Um, a healthcare provider will first ask about your symptoms, your medical history, and your family medical history. They'll also do a physical exam. This one. They may do blood tests and imaging tests as well. Okay, this one. So, Doc, can you please explain each one of this? Okay, this one. Number one, seroloplasmin test. Can you please share what is this, Doc?
Oh, ceruloplasmin. That's I don't know about ceruloplasmin. Oh,
Oh,
coagulant test.
mm-hmm.
It may be a coagulant test.
Maybe, Doc. I have no idea about this. Let me check first.
Coagulation. Coagulation.
Ah, coagulation. Yes. Okay, this one. Let me check here. Seroloplasmin. I will just check here, Doc. Seroloplasmin. Oh, this one. Seroloplasmin test. Uh-huh, uh-huh. Okay, this one. It is a test in the liver. This one. Oh, here, Doc. I will check this one, please.
Yeah.
This one.
Yeah. Con chào bác một tiếng, bác đang học bài. Mà vào đây học bài bác Hoa đi, vào đây, vào đây. Vào đây con ơi, vào đây, lên giường này học bác Hoa này. Bác cho con mượn điện thoại luôn. Yes.
This one. This is the
That's
seroloplasmin.
him. Yeah.
Okay.
Đồng. Yes.
Okay.
Con ơi, ở đây, ở
Next.
đây. Bác cho con mượn điện thoại của bác ở trên bàn bàn này con đây. Vào đây, vào đây, vào đây, vào đây, vào đây.
Okay, next, Doc. I will show you this one. The complete blood count. This one.
Oh, TBC test. I I often do this test in my lab. Yeah. Complete
Mm.
count to count the number of platelets, red blood cell, and white blood cell. It's about 24 in this test.
Okay. How about this one, Doc? The ferritin test.
Ferritin test to diagnosis anemia without low within low iron.
Low iron. Oh, yes.
Deficient.
Because the scientific name of iron is ferrous. It's from ferrous, Fe. That's why it's ferritin. Okay, next we have the folate deficiency test. What is this
Uh,
about, though?
to diagnosis anemia with a big size big size of red blood cell. Anemia with the patient is low folate level.
Mm. This one, Doc, I have a question for you.
Yeah.
Um, is folic acid important so that women will have menstrual period? This one?
Yes, it's substance to products red blood cells.
Mm.
Folic folic acid and yeah, iron and vitamin B12. Yeah.
Okay, this one, Doc. How about inositol? Inositol, this one. Is this for blood? This one?
No, I don't think so. Inositol is um is a cousin products red blood cell.
Oh, okay, okay. Now, Doc, let us go to the next one here. Okay, we have the vitamin B12 deficiency.
Yes.
Yes.
Vitamin B12 deficiency is a popular cause to anemia with
Ah,
which side of red blood cell.
oh, okay. This one, Doc. If someone has weak nerves due to lack of, oh no, due to vitamin
Yeah.
B12 deficiency, is it related to blood? Is it related to blood health? This one, Doc?
Yes.
Oh, okay.
Not vitamin B deficiency im to harm to not good to nervous function and
Ah,
yes, and to production red blood cell. Yes.
Okay, okay. Thank.
Not what the nerves.
Ah, okay, okay.
Mà đây, mà đây, nghe mà đây.
Okay, this one, Doc. I'm already here in the image test. First, we have this one, the MRI. The second, this one, Doc, positron emission tomography. What is this one, Doc?
No, no, no. I think it's a PET scan uh, are are not necessary to diagnosis.
Ah, okay, okay, okay. And then we also have the management and treatment. These are okay. Oh, so we have here, Doc. Can you please explain it, Doc? What are this one? What is the help of antibiotics, antifungal, and antiviral medication to fight infection?
Yes, because the patient with severe bone marrow failure is at has a low uh, white blood cell, so
Ah,
they often suffer from bacteria infection and fungal infection or viral infection. So
mm,
uh, we when they go to hospital, they often need but antibiology
antibiotic.
antibiotics.
Yes, yes. Okay, because they have weak immune system, Doc.
Yeah. Yes,
Ah, okay,
which
okay, okay.
immune system because a low ground white blood cell in neutral blood cell in the blood.
Oh, okay, okay. Next, Doc. Wow, there is number two here. Okay, this one. Blood transfusion to increase red blood cells and ease symptoms like bleeding and fatigue. This one.
Yes, blood
Ah,
transfusion is necessary always necessary to patient with bone marrow failure because
mm,
the bone marrow can't produce enough red blood cell, platelets, and white blood cell.
okay. This one, Doc. What about if the patient does not want to have blood transfusion. Um, are there alternatives? This one. This one.
Yeah, yes, the patient we often advise a patient with bone marrow failure to take care to undergoing stem cells therapy, stem cell transplant.
Ah,
It's the
okay.
first line to it's the first choice to treatment of this disease. Yes,
Okay.
the success rate of this therapy is about 50 to 90%.
Ah, wow.
Yes,
That's
yes,
that's high. That's
yes,
high. Yes.
and the
Okay.
person can't can't need can don't need uh, taking give uh, blood transfusion all of life.
Okay, wow. Okay, now we have the next question we have here is bone marrow stimulants, which help your bone marrow to make more blood cells. And then we have immunosuppressants to help
Yes.
stop your immune system from attacking your bone marrow. Okay, so Doc, what is your opinion about immunosuppressants?
Immunosuppressants is the second choice. Then
Oh,
bone marrow, then ah, after stem cell therapy,
okay, okay. So
person
after, yes, yes.
uh,
Oh,
has
so
a low success rate. then stem cell transplant.
Oh, okay. So
Transplantation.
after stem cell transplant, then
The choice. Yeah.
immunosuppressants, doc, this one?
Followed by stem cell transplantation.
Ah, okay, okay.
Second, second choice to treatment.
Oh, okay, okay. Then this one, doc, maybe this is what you meant, the allogenic stem cell.
Yes, allogeneic stem cell transplant is a first choice. We we test the healthy stem cell from donors and trans transfusion and and uh, trans this stem cell this stem cell to the patient. Yeah.
Oh, okay, okay. And then, Doc, we have here the treatment complications or side effects. Complications and side effects vary depending on the treatment, but
Yes.
stem cell bone marrow transplants may cause the most significant issue, including graft and host disease and infection. Okay, so I have a question, Doc. This one.
Yes.
Uh, um, can you please discuss the complications of these process? This one. Mm-hmm. This one.
Oh, the patient with the pulmonary failure is have enough it don't have enough white blood cell, so often yeah, suffer from infection. But uh, the stem cell therapy
Uh,
uh, is is help the bone marrow to produce um, blood cells better. But complication of this therapies is infection. But is rate of is very small. It's
oh.
it's about less than 10%.
Ah.
And this good choice of therapy. Yes.
Okay, okay. Wow, that's it. It's very interesting. Okay.
Mày đang
Okay.
đây con nói cho bác cái điện thoại kia.
Okay, we also hear prevention. How can I reduce my risk of bone marrow failure? This one. This one, Doc, my question. Please wait. How can we resist? How can we resist? Oh, how can we reduce
Yeah.
our risk
Okay.
in bone marrow infection? This one?
Uh, oh, not the efficient environmental, but this is efficient in the body. Sepsis, yeah. Not
Ah.
not efficient in bone marrow.
Oh, okay, okay. Next, let us
And
go
we are
to,
in efficient. Yeah.
oh, okay.
Uh,
Uh,
we um uh, we often use bacteria antibiotics antibiotics, yes, and
anti-
antivirus, and
oh,
and do this therapy in a sterile environment.
oh, okay. Wow.
Yeah.
Okay. Okay. This one now, Doc, we are going to go here. Bone marrow failure, symptoms and causes. Okay. I will make it big. Fit with. Okay, this one. Now, Doc, we have here the most common symptoms. Okay, this one. Let's just try to discuss someone. Okay, like this one, doc. Shortness of breath or dyspnea. So why is this happening if you have bone marrow failure?
Oh, because anemia.
Ah,
So the patient has a symptom including dyspnea.
okay, okay. And then this one, doc, we have this what we call skin here skin color that's paler than usual.
Because anemia
As
anemia
well as.
is enough red blood cell to uh, to on the enough blood cell grow in on breast cells and
Mm.
then so the patient has uh, um, uh, pale skin and cold skin. Cold skin.
Oh, okay, okay. And then this one, doc, we have the pitiche.
It is here. It's she. It's a
Mm.
symptom of thrombocytopenia. It's a group of symptoms in bone marrow failure.
Okay. Now, Doc, I'm going to go here already in the causes of bone marrow failure. So, Doc, if someone in the family has in your family has inherited conditions already, is it possible that someone will inherit it?
Yes.
Oh,
Inherited conditions is inherited diseases, and some of this is bone marrow failures in a pediatric patient.
Oh, okay. And then, Doc, we have the acquired conditions. I'll just go here. Certain types of cancer. Some cancers can damage the bone marrow. So, what kinds of cancer is this, Doc?
Oh, cause thyroid cancer, thyroid cancer,
Thyroid?
thyroid cancer, and
Oh,
yes, to the patient need to chemotherapy and chemicals uh, to damage bone marrow.
okay.
The
And
patient
then, oh, yes, Doc?
have more uh, bone marrow failure.
Okay. And then we have here, Doc, medications. Certain medications can cause bone marrow suppression. So, what are these medications, Doc?
Oh, some drugs with anti thyroid. Yes.
Oh, okay, okay.
Yeah.
Okay. And then, okay, I will wait for you, Doc.
Yeah. But the disease to take medication that these drugs can affect bone marrow function.
Okay, okay. Thank you, Doc. Now,
Hyperthyroidism, hyperthyroidism
hypothyroidism. Yes, that one.
medication.
And then we have the viral infections. Some viral infections can damage the bone marrow. So, what are these virus?
Oh, such as Epstein-Barr virus, CMV virus,
CMV?
cytomegalovirus, Epstein-Barr virus, uh, human deficiency virus,
Mm.
HIV. Yes. Um,
Oh, okay, okay. And
so,
then, Doc, wow. Okay. So, I will continue with the questions, Doc. I still have lots of questions here. This one. Okay. Here. Mm, what is the role, this one, Doc, what is the role of bone marrow aspiration in diagnosing leukemia? This one. Here. Oh, this one.
um, uh, bone marrow aspiration is a very is a procedure and test it is very important and not necessary can't be necessary to prognosis leukocytes.
Oh, okay. So it is really important for diagnosing or figuring out leukemia. Okay. Next is this one. What staining techniques, this one, are used to evaluate bone marrow samples? Okay, this one, doc. This one. Mm-hmm.
Then, oh, we always use gemcitabine,
Mm,
gemcitabine,
what is the color of that stain, doc?
gemcitabine staining to
Oh,
to do this test.
okay, okay. And then next one is how can bone marrow um aspiration help in staging certain cancers? Let me put it here. Mhm. Okay, this one here though. Okay.
Um, the test bone marrow aspiration to take the sample to do pathology in to do pathology test and this the hematologist can diagnosis uh, other cancer to metastase to bone marrow.
Oh, okay. That is a good one. Okay, Doc. And for the last question, Doc, tonight, this one, what is the significance of the myeloid to etheroid ratio? Oh, this is, I'm not familiar with this one, Doc. I will post it here. Okay. This one, Doc. What is, okay, this
Oh, myeloid, uh, myeloid is
one. Erythroid.
the cell like S and the cell like S, including the blood cell and longer blood cell, white blood cell. Yes,
Okay.
yes.
Okay.
And erythroid is including is cells lineage of uh, red blood cells and
Oh.
stem cell of this. So the rest of myeloid and erythroid is very important to diagnosis of some types some types of leukocytes.
Oh, it's all about the diagnosis of leukocytes.
Yes, types
Oh,
of leukocytes.
size. Size.
Classification of leukocytes.
Oh, the classification of leukocytes. Okay. Doc, thank you very much for tonight. Okay. I will see you Thursday. Bye-bye.
See
Thank
you
you.
next
Thank you, Doc. Good night.
time.